After I finished my MS in July 2021, I was not sure about anything, how to proceed. No, I had no guidance actually. Then I had texted you on Instagram. I remember that, sir, could you please tell me? Could you please guide me? Then you shared me a link that you will be taking a video. You will be taking a live session on how to approach. So that was the turning point actually in my life, because I did not actually know how to prepare, and there was no senior who could guide me. That yes, I did not even know the names of those but big books like Shackelford and Bloomgart actually. So I'm talking very honestly. And after looking at your video, I decided, okay, I should join Marrow. And since you have taught me before also, so it was better to get taught from the person who you can understand, whom you can connect actually. So that is why I joined Marrow. My strategy was to complete a topic and then jump onto the MCQs, rather than just going to the MCQs randomly. So I used to complete one topic and then jump onto the MCQs, and not even like I have completed today the esophagus. So I will not jump onto the esophagus MCQs tomorrow. I will take 3 to 4 days, so that whichever has to fade, whichever things has to fade, they get fade away. And after that, I'll remember. Okay, I cannot remember this, so I have to read it again and again. I have given Marrow all the GTs of Marrow, and those were the most important part, I believe, especially the general surgery GTs. I used to give all the GTs, and progressively I could see the improvement in me. I secured a rank of 7 in the first GT, and eventually I secured rank of 1 in all the GTs in the general surgery part. At least 100 MCQs a day within the time limit of 1 hour is recommended to keep in touch. And out of which at least 80 questions would be from the topic you are reading or you have read in past 1 week, and 20 random questions, so that you may have a edge over all those topics which you have read or you are about to read. Since I told you that I did not have any idea about the subject, and I was seeing
You
these
do not
videos for
read
the first
short
time.
documents.
No, sir, I just referred to them. Honestly
Okay.
speaking, I just referred to them, since the notes I had made from the three of you were actually so complete that I did not even refer to the chapters you have taught for the reference. For few things, I had to take reference from Shackelford and Bloomgart. Rest, at least your notes, sir, I would say that your notes were totally complete, and you have actually taught for stage two interview part also. You have showed all the images well, that how to identify specifically the hepatic tumors, how to identify these tumors, and how to approach for the MCQ also. So those things, specifically your videos in that part, the tricks to how to solve the MCQs, those were very helpful for me. There was one CT image I could identify that very easily because of his teachings, and I'm really thankful for that, sir. That you have helped a lot from stage 1 to stage 2, actually in both the stages. After actually looking at the videos, after when I was making my notes, I used to see that yes, this is directly from Shackelford, this is directly from Bloomgart. Sir has covered all the important points from the Shackelford, so why should I read, right? If I'm getting a crux of it, why should I go and read the textbook?
Hello everyone, I'm Dr. Rohan Khandelwal, your Marrow SS General Surgery faculty, and I have the immense pleasure of introducing Dr. Kartik today. Dr. Kartik has secured rank 1 in the recently conducted AIIMS SS exam in surgical gastroenterology. And I feel more proud because I remember teaching him as an undergraduate way back in 2015, and he's come such a long way after doing his post graduation and finally securing a rank 1 in the AIIMS exam within 1 year of passing his MS exam. So heartiest congratulations, Dr. Kartik. We are also joined by Dr. Prasanna Gopal, who is our Marrow SS gastrosurgery faculty. He takes the hepatobiliary part, and sir would also be asking certain questions which would help you people who are listening to this interview to prepare better for the future exams. So Kartik, how does it feel?
Sir, I'm still in a state of shock actually. I cannot believe I've talked to people. Please see my result and tell me that yes, it is rank 1. So I'm still in a state of shock right now. I cannot believe myself that yes, I've secured rank 1.
Great.
But yeah, it gives me immense pleasure now that yes, I have achieved something in my life now. So it's a good feeling, sir.
Great. So why don't you tell us something about yourself? I know you're an undergraduate and postgraduate from Maulana Azad Medical College, which is one of the most prestigious medical colleges. So just
Yes, sir.
briefly tell us about your journey in your medical career, and when you started and how did you start preparing for super specialty.
Yes, sir. So, sir, I started my undergraduation from Maulana Azad Medical College, as you correctly said, in back in 2012, and I finished it in 2018 March, around March. And in the first attempt only, I got a seat in NEET PG through NEET PG in Maulana Azad Medical College only in general surgery, and I did it from 2018 to 2021. So after I finished my MS in July 2021, I was not sure about anything how to proceed. No, I had no guidance actually. Then I had texted you on Instagram. I remember that, sir, could you please tell me? Could you please guide me? Then you shared me a link that you will be taking a video. You will be taking a live session on how to approach. So that was the turning point actually in my life, because I did not actually know how to prepare, and there was no senior who could guide me. That, yes, I did not even know the names of those but big books like Shackelford and Bloomgart actually. So I'm talking very honestly. And after looking at your video, I decided, okay, I should join Marrow. And since you have taught me before also, so it was better to get taught from the person who you can understand, whom you can connect actually. So that is why I joined Marrow. And I started preparing in around September, starting September first week. I started my pro course, and I was looking the general surgery videos, since the pattern was the general surgery exam only, and the pattern reverted. Then I started seeing the videos of surgical gastroenterology by Prasanna sir and Shankar sir and Venkateshwar sir. So I finished the complete videos of general surgery and surgical gastroenterology videos in around 3 months, 2.5 to
Okay.
3 months.
So I
Yes,
think so
sir.
that is very important. I'm sorry I'm interrupting you, Kartik, because that I want to re-emphasize for students who are preparing that within 3 months he was able to finish all the general surgery videos and the subspecialty videos. And how many hours were you devoting to watching the videos every day?
Sir, I did not just watch it. I used to make my own notes, because I had this bad habit of I cannot read notes of some other person. I can only read my notes from my handwriting only.
I think
So,
such a good
sir, I used to, yes. So, well, it took me a lot of time actually, sir. Otherwise, I would have completed those videos in just 1 month if I just had to watch it, right? So, I used to devote my time for around, sir, 6 to 8 hours a day, and to just watch and make the notes. And I did not just make notes, sir. Actually, I used to see the videos of one topic and then make notes of that. And before jumping onto the other video, I used to revise those topics, right? And after completing one chapter per se, for example, after completing esophagus, I used to revise whole of the esophagus before jumping onto the stomach. So that is what I want to tell to the people, that do not just see the videos and make notes of everything, and then you have to start again from scratch. That, oh, you have to do the all those four. I actually made my notes of surgical gastroenterology were of 1500 pages. So if I had just seen the videos and made notes, so it would be very difficult for me to just start again from esophagus, right?
Right.
So that was the thing I would like to tell the students, aspiring gastroenterologists.
So I think so some very important points. A, it is feasible to finish everything in 3 to 4 months time, and even by making your
Definitely.
own notes. And I think so making your own notes just reinforces the concepts which you're listening to in the videos. So it's always useful to make your own notes. So in addition to this, Dr. Karthik, I mean, some students always ask this, that were you working while you were preparing, or were you just preparing for the SS exam?
No, sir. I was just preparing for my SS exam, but I had some ups and downs during my preparation phase. I had lost my grandmother, so I was not able to devote my proper time for that. So
So
even if you're working, I believe you can give 6 to 8 hours a day, or if not 6 to 8 hours a day, at least 6 hours, 4 to 6 hours a day. If you give, you will be able to complete in 4 months at least.
So, Dr. Karthik, on an average, how many MCQs should a person who's preparing for the exam solve on a daily basis to keep in touch with the art of solving MCQs and keep in touch with the subjects which they are, or the topics which they are reading or revising?
Sir, I would suggest at least 100 MCQs a day within the time limit of 1 hour is recommended to keep in touch. And out of which at least 80 questions would be from the topic you are reading or you have read in past 1 week, and 20 random questions, so that you may have a edge over all those topics which you have read or you are about to read. So at least 100 MCQs a day in at least 1 hour, in not more than 1 hour. I mean,
And you said that you appeared for all the GTs. What about the mock tests which we had organized recently before the exam? Did you appear for those
yes, sir.
mock tests as well?
Yes, sir. I secured rank one in that also.
Great, great, great.
Yes, sir.
Um, so one common query which I get from all aspirants, SS aspirants, is that there is a huge difference in pattern. INI SS is 50-50% general and super specialty, whereas NEET SS now is going to be 100% general surgery. So how does one approach both the exams, or what was your approach? Any tips which you would like to share?
Yes, sir. So, sir, after giving my NEET SS in January, I knew that INI SS would be in somewhere in April only, and NEET SS we had the date in 19th June. So I had the thing in my mind that since I have read all the since I've seen all the videos and I've read the surgical gastroenterology in depth, and for general part, so sir, I have seen all your videos. I've been seeing it from the 2015, so I knew I was competent in that. So I focused more on surgical gastroenterology actually, and I had this approach in my mind. If I don't get a seat in INISS, then for the last 2 months, I mean May and June, I will read the general part, since it is more important in the NEET SS part. And for INI, definitely surgical gastroenterology is more important. So I devoted my 2 months for that, and just 10 days for general surgery, since I told you the reason why.
Okay. And about this INI SS exam, and in general, when general surgery is asked, even in NEET SS, are there any specific topics which you would like to tell the aspirants to focus more on when they are preparing in general surgery?
Uh, Definitely, sir. Sir, I don't know why I had this gut feeling that this INISS they will ask trauma questions more. The last INISS they asked just one trauma question, and if in this one I had this gut feeling, I don't know why, and it actually came out to be true. There were like more than 4 or 5 questions from the trauma, and start from your notes actually, from the ATLS guidelines you have taught. So I would recommend, sir, at least this trauma part one should read, and a little bit of urology, not in too deep. I mean, the part you have taught actually is enough actually, and all the subspecialties you have taught. The basic idea of all the subspecialties were good enough. So the trauma part and endo part is more important in this INISS part is INISS. And in NEET SS, sir, I actually cannot give you the review because the last NEET I gave, there all last pediatric surgery and urology. So
Yeah, they
that
were
was a change in the
different
pattern.
general surgery questions for different set of people. But you rightly said, I guess, focus more on trauma and on endocrine, that is breast and thyroid, because these are common areas which are asked. One more neglected area is vascular. I guess a lot of students don't, until
Yes,
unless
sir.
somebody is preparing for vascular or CTVS, they neglect that as well. And that also one should read, because at least 2-3 questions come from that portion as well.
And in fact,
Uh,
you when you teach, sorry to interrupt, sir, but when
yeah.
you teach trauma, you actually cover all those aortic injuries and vascular injuries also in trauma only. So that majorly covers the vascular part as well.
Correct. Right. Prasanna sir, over to you. Why don't you ask Karthik about the subspecialty part? You'll have a lot of questions which students can gain from. So over to you, sir.
Yeah. Hello, Kartik. Congratulations
Hello,
first
sir.
for you. Yeah.
Thank you, sir.
So,
Thank you so much.
which book the questions were asked, like Blumgott or Shackelford for the specialty part?
Sir, I believe they had more focused on Shackelford and Sebastin. Bloomgard's, they did not ask much questions.
Okay.
So,
So,
but I have to say that if you have to crack INISS, you
yeah.
may read Shackelford, or you may not read Shackelford or Bloomgard, but you have to read Sebastian. Without
Yes.
Sebastian, you cannot crack any entrance exam.
Okay. So, how was the videos helpful in preparing you for your specialty exam?
Sir, since I told you that I did not have any idea about the subject, and I was seeing
You
this
did not
videos for
read
the first
short
time, no, sir, I just referred to them. Honestly
Okay.
speaking, I just referred to them, since the notes I had made from the three of you were actually so complete that I did not even refer to the chapters you have taught for the reference. For few things, I had to take reference from Shackelford and Bloomgard. Rest, at least your notes, sir, I would say that your notes were totally complete, and you have actually taught for stage two interview, for interview part also. You have showed all the images well, that how to identify specifically the hepatic tumors, how to identify these tumors, and how to approach for the MCQ also. So those things, specifically your videos in that part, the tricks to how to solve the MCQs, those were very helpful for me.
Okay. Good. Thank you.
Yes, sir.
So, what about the interview part, Kartik? I mean, what do they ask in the interview? A lot of aspirants messaged us before that, what should we prepare? Should we read about our thesis also? Should we read about latest publications? So, what exactly happened in the interview, if you can share for everyone's knowledge?
Sir, so sir, the interview was actually in two parts. The first part was the direct spotters. So they gave me five spots and related questions, which we used to get in our UG and PG exams. But those were a little difficult, right? And there were CT images also. There were specimen images also. So that is why I told that Prasanna sir has taught so well that I could, identify the images of the CT. There was one CT image I could identify that very easily because of his teachings, and I'm really thankful for that, sir. That you have helped a lot from stage one to stage two, actually in both the stages. So there was one. They have this, set pattern that one question would be from ABGs, and one question would be from your CT image. One question would be from some post-op complication. One question would be from a specimen, and like that. So there were five spotters,
These
and
are all MCQs or spotters. I mean, they give you a
such
history and they
spotters.
just yeah,
Yeah,
okay.
like that. Yeah, so CT may they had given a history, and then they have given some drug, XYZ drug, and they have given two images that they have prescribed the drug to the patient for 6 months, and CT of A and B after 6 months and before 6 months was given. So they were like, diagnose the condition. They have given a ABG and asked the question like, what is the diagnosis, and mentioned two clinical conditions which you can see in surgical ICU, surgical gastroenterology ICU. So like that, direct spotters during the UG PG days, sir, not MCQs.
Okay.
And for the
Got
second
it.
part, sir, so two of the faculties were there, and they both asked different scenarios. They gave us a scenario. For example, I got a scenario of 45-year-old male came to you with upper GI, he's vomiting blood. Then how will you proceed? So basically, they wanted to know what your clinical skills are. Have you worked in the clinics? Have you worked in the wards? So all those stuff. And the second one asked me about the bile duct injury, like that. So basically, they'll give you a case scenario. They also have some set of questions, set of cases also, which they usually keep there. For example, all the important cases that they operate, like CA esophagus, caustic esophageal injury, and your EHPVO, NCPF, all that stuff, sir. So there are around 12 to 13 topics which they usually ask from. So
Okay.
it was more of a approach thing, not the theory part. It was more of a approach thing. How will you proceed with that for that thing?
Correct. Right. So, like you also said that you did not read Shackelford or Bloomgard because you hadn't made up your mind that you wanted to do surgical gastro in your PG time. So, do you think that that was a handicap for you, or with the videos which Dr. Prasanna and the other faculties have covered, you could easily get over that handicap, and you could easily, just um, get everything in one place with the videos?
So, so the first thing, I always wanted to be a gastroenterologist, surgical
Okay,
gastroenterologist, since my
all right,
class seventh actually. But I did not
right,
know how to approach. Right, I
sure.
did not, as I mentioned, I did not know the names of the books also. But yes, since I've seen the video, sir, So after actually looking at the videos, after when I was making my notes, I used to see that yes, this is directly from Shackleford, this is directly from Bloomgard. Sir has covered all the important points from the Shackleford. So why should I read, right? If I'm getting a crux of it, why should I go and read the textbook? I was getting him all the important points from the videos. So that is why I focus more on the videos. I watched your videos, sir, for like 3 times in total. Even after making notes, I used to watch your videos so that sometimes it happens that while making the notes, you may miss 1 point or 2 points. So I had watched those videos 3 times, and those were I can say, sir, at least 60 to 70% of the Shackleford and Bloomgard it had covered. So for few topics, I had to refer and I had to read from the book. But for the major chunk of it, I did not read it, and it was not handicap for me since I have watched the videos.
So I think so that is very important what Dr. Kartik is mentioning, that you need to stick to one resource and have faith in that resource. Like he's saying that if everything was covered there, there was no need to go here and there for other information. And all the information was beautifully covered by the three surgical gastroenterology faculties, including Dr. Prasanna. What about MCQs and subspecialty, Dr. Prasanna? I mean, if you would like to elaborate on that, what do you recommend? And Kartik, what do you recommend? How should students do MCQs for surgical gastroenterology? And how did the Marrow MCQs help you in that?
So I feel just smallest drawback of Marrow was that there was no surgical gastroenterology MCQ bank, right? So I had to do it from the general surgery part, and but yeah, the general surgery part also had some questions directly from the Savistan, and they were actually of the super specialty level in the NEET PG group only. They were of the super specialty level, but the tests, the grant tests which you had put in the app, those questions, after reading all the notes, I could easily answer the all the questions. So, sir, one thing, if I can, advise for something, that is that
Absolutely.
you should, sir, Marrow should actually, improve, not improve actually, but Marrow should actually add the surgical gastroenterology MCQ bank, so that the aspirant has everything in one app.
So the QBank and notes, the two major requests which we are getting are regarding the QBank and notes. So the QBank team is already in place, and very soon that QBank will be, made live. And as you said, as it
Available.
is, we were making questions from latest substance, so that part got covered up. But your point is well taken, and we are also working on printed notes because some students are complaining that they don't get the time to make their own notes. So we are also working on that. Prasanna sir, would you like to elaborate? I mean, how should a student do MCQs also along with studying? And can you elaborate on that, please?
I think Dr. Kartik rightly mentioned that after preparing a topic, he waits for 4 days and then only he answers the MCQs. That is very important because once you start forgetting one point, you will keep forgetting the same point again and again. So what I would suggest is for those who are preparing, when you put all the MCQs and find out which are the questions you have made it wrong. So find out the wrong questions, like whichever you have answered wrong, and this is the same, and may note it down in your own notes which you have prepared already, because these are the same questions you are going to make it wrong again. So these are the questions which you have to revise again and again. The points which you know already, you don't have to revise, you will definitely answer it rightly, but those points which you have mentioned put wrong answer, that will definitely put it wrong. Okay, so you have to revise those questions again and again. That is one advice from me.
So as sir said, either mark them, or in the Marrow app, you also have the feature of bookmarking that question, and you can
Bookmark.
always review that later. So that is just facilitating your revision. So great, Karthik. I mean, a lot of great insights from you on regarding how you prepared. Before we end the interview, any final tips for students who are in second year, third year of their post graduation and are now thinking about preparing for super specialty? What would be your advice to them?
Sir, my advice to them would be that it is not a tough game, and it is not impossible also. It is very well doable. If I can do, anyone can do. So start reading from the first year only. I would suggest this. I did not read. I made the mistake of not reading from since my first year of my post graduation. So I would advise people to take at least 1 or 2 years subscription from Marrow and see all the videos of that subspecialty part. And since it is 2 or 3 years are still left, then you can definitely make notes and revise it very well. And the second part, sir, I would like to say emphasize on the pearls which you have on Marrow app. Sir, I had read all the pearls before my exam. Before my exam from for INISS, I had seen all the pearls. So those pearls are like really important. They're actually last minute revision points. So I would suggest everyone to go through those pearls before your exam, because they cover every whole of the chapter, whole of the subject in a very precise manner.
Also, were the general surgery videos useful? Because you told me that you'd been seeing my videos ever since you got into MS. So, were they helpful in cracking your MS exam also and during your MS as well?
Definitely, sir. I had your notes from the UG days. I used to read those notes, and I could answer all the questions from the my professors during the rounds. So those were very helpful for me. I still have my 2014 and 15 notes with me, which you have taught, sir, because those are like precious notes for me. They have helped me throughout my journey of my MBBS and then MS and now INISS super speciality. So definitely, sir, I would recommend all those people not to just throw their notes away, but to keep on revising those notes, and then so that they can get the crux of that thing, chapter.
Great, great. Prasanna sir, anything which you would like to add or you would like to ask Karthik?
Nothing, nothing.
Great. So I think so. Dr. Karthik has shared some very important points, and the key points, if I can summarize, is to start early. And now that there is more focus on general surgery in the NEET SS exam, you need to look at the general surgery videos as well. Again, with experience, I can tell you that majority of the questions are covered from Bailey and Sabiston. So if you're thorough with these two books and the videos, you can answer more than 80% general surgery questions. For super speciality, especially gastroenterology, as Dr. Karthik has mentioned, it's been beautifully covered by three faculties on Marrow. And that even covered up his handicap of not reading the standard textbooks like Shackelford and Bloomgard. Also, he mentioned that please do MCQs. That is very, very important. So, Karthik, final words of motivation for budding aspirants, and then we end the interview.
Definitely, sir. Sir, I would suggest all the aspirants that they should join Marrow, and they should at least look at your videos if they are preparing for NEET SS exam. I am 100% sure that if they just cover your videos, they will definitely do 70 to 80% of the MCQs that are asked in the NEET exam. I'm not asking about mocks and all that, in the NEET exam. So in my recent NEET exam also, all the maximum of the questions were from the general surgery of the urology part, and of the pediatric part were from your notes only. So I would definitely recommend looking at your videos, and just do it. There's no other way. You have to do hard work, and there's no shortcut for that. So you have to just read and read and read and revise. That's the final words from my side.
So Dr. Karthik is being very humble, and we are friends on Facebook, and I keep on seeing his posts. One thing which is very good about him is he's very devoted, and having faith and in his own capabilities and doing regular hard work. That is what leads you to success. So great,
Yes, sir,
heartiest
definitely.
congratulations from the entire Marrow team, Dr. Karthik, and thank you for sparing
Thank you.
time.
Thank you so much, sir.